Conjunctival ballooning during phacoemulsification is an intraoperative challenge which we sometimes face during phacoemulsification surgery. Now, the main challenge that we face when the conjunctiva is ballooned is the fact that it causes the fluid to pool over the cornea, resulting in annoying reflexes that can impair the intraoperative visibility. Thus, dealing with the conjunctival ballooning is an important step to managing it during surgery. What we really need to understand is that what causes the conjunctival ballooning. Conjunctival ballooning occurs when the fluid, which is meant to go within the eye via the phacoprobe or the irrigation aspiration, finds its way into the subconjunctival space because of a breach of the limbal conjunctiva. And keeping this in mind, we need to be very mindful in the incisions that we make. That's why I like to have clear corneal incisions, because clear corneal incisions do not disturb the integrity of the limbal conjunctiva. Should there be a breach in it, there's sometimes a backflow of fluid via the phacoprobe or via the irrigation aspiration into the subconjunctival space. Now, if it is picked up early, it can be managed by quickly stopping the surgery at whatever point you're at, cutting the conjunctiva, and the technique for doing it perfectly is what I will show you in the coming videos, and then you've dealt with the problem before it could get too much. If it is left unchecked, it can result in a circumferential ballooning of the conjunctiva, which I said earlier, can result in annoying reflexes from the pooled fluid over the cornea, which will then hamper your intraoperative visibility. Once it has occurred, here's how I think it should be managed. Here are two cases discussing the same. Let's move to case 1. Here's a case where there was a localized subconjunctival ballooning which was picked up during the end of nucleus management. Upon looking more closely, you will notice a breach in the conjunctiva at the area of the main incision. And therefore, you'll now be able to understand how the backflow of fluid from the phacoprobe has found its way through the breach in the conjunctiva at the area of the main incision into the subconjunctival space. Now let's see how this is surgically managed. The conjunctiva is held with a pair of tooth forceps, and having stabilized it, it is lifted up, and having grasped it well enough and lifted it up, it is cut with the help of a Westcott scissor in a radial fashion. Having cut the conjunctiva as well as the tenons, then with the help of a cotton bud, often brought in from both sides, the fluid is milked out through this opening now created in the conjunctiva, resulting in the flattening of the conjunctiva. Depending on the extent of the conjunctival ballooning, it may take a little more time, and often it may take more than one radial cut in order to decompress this conjunctival ballooning. In this case, one single radial cut was adequate. As you can see, we've achieved a flattening of the conjunctiva, after which we are good to now proceed with the surgery, and you will find that no more conjunctival ballooning occurs even during the rest of the procedure. Let's now move to the second case. Here's a patient who had an extensive subconjunctival ballooning following the peribulbar block. This kind of a picture can also be seen in a patient wherein the subconjunctival ballooning, when it starts to happen, goes missed and it becomes rather extensive intraoperatively until finally it is noticed, and then we have to deal with it. Now let's see how we managed this extensive conjunctival ballooning. Now, in a case with an extensive ballooning like this, I have found that just one radial incision is not adequate. So I make two incisions, one on either side, after which two cotton buds are used which now press on the globe on either side of the radial tear, resulting in the removal of the subconjunctival trapped fluid and a flattening of the conjunctiva. Note that when you make a radial incision, you do not disturb the limbus at all, and at the end of this, you will notice flattened conjunctiva. Now, should this have been an extensive subconjunctival ballooning that had occurred as a result of a tear created at the limbus during the phacoemulsification procedure, you will find that having created a radial tear at the main incision will prevent any fluid from further entering the subconjunctival space, and you'll be able to carry out your surgery with ease. So to summarize, the main take-home messages from this video are: recognize the occurrence of a conjunctival ballooning early on, stop whatever you're doing, make a radial cut at the area of the incision where there is a tear in the conjunctiva which has led to the conjunctival ballooning in the first place, decompress the conjunctiva, and finally then proceed with your surgery. I hope you did find this video tutorial useful. Thank you.